Dr. Dixon, what are the most common pelvic floor symptoms women experience during perimenopause that they have been too embarrassed to ask about?
That's a great question. So many women will experience leakage for their first time, and that could mean urinary leakage. Sometimes it happens after having babies, but sometimes it doesn't happen until perimenopause as our hormones are fluctuating. The other most common symptom I see is pain with intimacy, and that also could be related to hormonal changes, and that the tissue is a little bit drier and less supple, and so that can make intimacy painful.
What are some of the treatments that you are maybe prescribing outside of the actual therapy that you're doing?
Treatments that I'll prescribe include definitely doing home exercises. So I will give you exercises to do while you're in physical therapy with me and make sure you're doing them correctly. Sometimes at home you're going to be using trainers or dilators. There are many different tools we use in physical therapy that you can use in the comfort of your own home so that you can get the tissues to relax if they're too tight, or you can work on strengthening at home as well.
And what does a pelvic floor PT session actually look like? I think most women really have no idea what to expect when they come to see you.
Yeah, a lot of times I like to explain it. It's kind of like going to the OBGYN, but more likely in a spa setting. It's more like being at the spa because I have heat on the table. I usually will have music playing, I can dim the lights, so I want to make sure that people are comfortable when they come into that environment. And we'll sit down at first and we'll talk about what symptoms you're experiencing. Once we go through a very thorough history, then we will do an evaluation, and sometimes that is an internal evaluation. With that internal evaluation, we of course use gloves and we use lots of lubricant because we don't want anyone to experience pain. And we will insert one finger and assess the muscles in the pelvic floor. We'll have you just gently contract and relax. And that is usually the baseline of just kind of where we need to assess the muscles. And then after that, we'll give you some exercises to connect that muscle contraction to your breath as well.
Dr. Dixon, what can women do at home right now to start supporting their pelvic floor?
The first thing they can do is just tune into their pelvic floor. So I'm going to uncross my legs and just sit here. And I want to feel the seat bones, the bones in my bottom that I'm sitting on. And I want to feel those on the chair. And our pelvic floor is between those two bones. And so we want to first assess, do those muscles feel tight or do they feel relaxed? We would want them to be relaxed right now. So the first thing to do is just check in and make sure you're not clenching your pelvic floor.